Hi, welcome to everyone who's coming in from the waiting room. I'm going to give everybody just a second to get settled and then we will get started. It's nice to have everybody here tonight. Welcome. Just so everyone is aware, we are in the process of recording our panel discussion tonight. You're welcome to stay with us with your cameras off if you don't wish to be a part of the recorded conversation. That's not a problem at all. I encourage you to stay. Along the way, I'm also going to ask that if you'd like, you can put your questions into the chat and we'll be moderating that tonight. If you feel brave and you would like to come off of mute and ask your question, we'll save time at the very end for live questions. So along the way, feel free to put stuff into the chat. Specifically, if you'd like to ask one of our panelists a question tonight, you're welcome to do that. So welcome everybody. My name's Mandy now, and I'm the Executive Director of Health Professions Week. I am so excited to welcome our panel here tonight. These are all wonderful current professionals who are practicing in their field and going to share a little bit about their journey to their profession in dermatology. And we have a wide variety of panelists tonight, and I'm excited to welcome them. So let's get started. Dr. Cleaver, welcome. It's nice to have you here. Go ahead and take a minute to introduce yourself.
Well, thank you very much for having us here and welcome everybody. My name is David Cleaver. I'm a practicing dermatologist in Kirksville, Missouri, which is rural northeast Missouri. I've been in practice for the past 12 years. I went to 4 years of undergraduate education and then went to 4 years of osteopathic medical school in ATSU Kirksville, Missouri, and then did 1 year of a general internship and then 3 years of dermatology residency. I'm now practicing, seeing patients every day. I'm also the program director of a dermatology residency program, as well as I instruct dermatology at the osteopathic medical school, AT Still University in Kirksville, Missouri. So I have a lot of experience with education and look forward to this discussion.
Wonderful, thank you. Sydney, why don't I have you go next?
All right, hello everyone. My name is Sydney Zell. I'm a certified prosthetist orthotist, so I'm a little bit different from dermatologists, but we do in my profession deal with folks with dermatological things. Sorry. So I'm practicing in San Antonio, Texas. I've been at my position just over a year now, but I've been in the profession for about 5 years. I started out east and I needed some warmer weather, so I came south. I didn't want anywhere snow, so I'm loving it. I did 4 years undergrad in Wyoming, and then I went to Texas State for a master's in exercise science. And then I decided, oh, just keep going. And so I got a master's in orthotics and prosthetics from Eastern Michigan University. And then I did a 2-year residency at the University of Wisconsin Hospital and Clinics.
Wow, you really have picked some of the coldest places that you could study.
Yeah, that's why Texas is home now. I'm not going back, and we're shoveling.
That's outstanding. Dr. Lowell, welcome. It's nice to have you here. Tell us a little bit about yourself.
Hi, Mandy. Thanks so much. I'm Dr. Danae Lowell. I'm a podiatrist, and it sounds like a cliche, but I grew up always wanting to be a doctor. I never knew what my chosen profession was, even until I was in pre-med. I obtained my Bachelor of Science degree at Notre Dame College, Ohio, and went on to medical school at what is now called Kent State University College of Podiatric Medicine. Every year I became a little bit more specialized in the field of lower extremity care, and this culminated in 3 years of residency and a fellowship in medical and surgical training at the VA in Cleveland, where I now have practiced for just over 21 years. I spend my time educating students and residents. I'm involved in a huge residency program here in Northeast Ohio. I'm in the operating room, the outpatient clinic, on the wards, and doing research. And I'm involved on a national level in some podiatry-related organizations. I'm both board certified in podiatric medicine and surgery. And I'm so happy to see a prosthetist on this panel. We work very closely with them on a daily basis. So I'm honored to be part of this panel. Thank you so much.
Well, thank you. It's nice to have you. Dr. Sims, welcome. Tell us a little bit about yourself.
Hi, Mandy. Thank you for having me. My name is Dr. Dejara Sims. My patients call me Dr. DJ. I am, just because it's hard to say Dejara. And there are like 3 other Dr. Sims that actually live in California that are Black women. One is a naturopath, actually. So we just do that for distinguishing purposes. But I'm a practicing naturopathic doctor. I'm licensed in the state of California. I received my bachelor's degree from Prairie View A&M University in Prairie View, Texas, with biology as my main area of focus, and my minor in chemistry. And then I went on to actually osteopathic school, which is interesting because I remember doctor, we actually played AT Steel in a rotator cuff basketball tournament back when I was at Kansas City University. It was actually called University of Health Sciences back then. And that was many, many moons ago. I did not finish my osteopathic degree because I found naturopathic medicine, which aligned more with my interests as far as doing, as far as naturopathic medicine is concerned, being a doctor who's focuses in primary care, leaning towards using herbal medicine. I'm trained in acupuncture and Chinese medicine, homeopathy, and diet and lifestyle changes using supplements and vitamins. And so that ended up being my path. So after being in osteopathic school for 3+ years, I ended up coming and transferring into a naturopathic school. I went to Southwest College of Naturopathic Medicine, which ironically has now changed its name also. It's now Sonoran University of Health Sciences in Phoenix, Arizona. I did 4 years of, I'm sorry, actually, because I was already in medical school, I only did 2 years, but it is a 4-year medical institution. But I was already in medical school before, so I got to transfer all of those credits, thankfully. I did 2 years at Sonoran University of Health Sciences. And then after that, because naturopathic doctors do not have formalized requirement for residency, it's because there's very few residencies, but a lot of students, and we're building to have more residencies. And there is no formal residency in dermatology. I did all of my postgraduate training on my own with doctors. So I ended up doing majority of my postgraduate training in a drug rehab facility. And I can share with you all later after introductions how that led to, because it was a very out of the way leading to dermatology. And now I practice primarily in treating acne, eczema, psoriasis, and hair loss with natural medicines only, without the use of medication. So I call myself an integrative practitioner because I have the ability as a naturopath to use medications, but I generally opt not to and use them as a last resort. And that's kind of the crux of naturopathic medicine. I use surgery and drugs as a last resort, and we use diet, lifestyle, and supplements to treat. So that's my story in a nutshell.
Wonderful. Thank you. So, okay, let's just dig right into this. Tell us a little bit about what drew you to your profession overall, and then what was it about, this practice in dermatology, or your ability to treat dermatological cases within your profession? What drew you to this? Sydney, let's start with you.
All right, so for me, when I was a junior in college, my mom actually lost her leg because I thought I was going to do physical therapy. I was set, I was applying for schools, and then she lost her leg. And that kind of changed my course, to seeing what her relationship was like with her prosthetist. And I had been through physical therapy a bunch myself. So I was like, oh, that's something I'm super interested in. But you only get to see your patient for so many treatments before you don't see them anywhere. Whereas with my mom and her prosthetist, they grew and they had this wonderful relationship. And as long as you stay in the same place, it grows into like a lifetime of care with the same person. And you really become like family because you're always seeing them for different things. So I was like, oh, that's kind of cool. I think I want to do that. Little did I know I had to deal with feet. I wanted to work with people who were missing limbs, not with limbs. So I didn't know orthotics meant feet until I did my research, and I was like, well, okay, I'm gonna do it. So now I deal with both missing and regular feet every day, and it's not as bad as I anticipated. At first it was a little horrifying, but now I'm all good, and I love what I do, and I wouldn't change it at all. So it was just my mom's relationship with her prosthetist, seeing that and knowing that I wear so many hats as a orthotist prosthetist. There's so many different things that get integrated. I get to use my hands a lot. So it's like I can be an engineer, do lots of like psychology with just talking to patients. Sometimes I'm a seamstress. It just depends on the day. I've been metal some days, like literally everything. Paper mache artist, I'm everything. It just depends on the day. So that's really what drew me. And then in relation to dermatology, a lot of times our patients, they have issues in which we have to figure, like, especially with the type of materials that we use. If they have a reaction or allergic reaction to them, then we have to figure out what materials we're using and how we can use other materials to see if that will help. Sometimes they're liner. A lot of times with liners, you sweat a lot. And so that just turns into not so good things sometimes. So we have to figure out a barrier in between that, or what other material we can use. So I mean, it's really fun because sometimes you're just like, I don't know what I'm going to do. I'm just going to try this, and random things work that you don't imagine will work, but it's always nice.
Sounds like you get to be very creative at your job. That's exciting. So
yes. And
Dr.
I wasn't
Lowell?
creative until now.
Dr. Lowell, how about you? What drew you to podiatric medicine, and how do podiatrists treat dermatology cases?
What I found out about my career is that people come to see podiatrists every day with various complaints of the lower extremity that can be directly related to pain, wounds, infections, soft tissue masses, traumas, or skin changes. And more often than not, they come with a specific complaint, and sometimes we notice something else. Frequently, if noted, subtle changes in the skin are not even considered important by the patient. Maybe they can't see it because it's between the digits on the bottom of the foot or behind the leg, sometimes because they can't see at all. Diabetes takes its toll on the eyes, the kidneys, and the nerves, putting the patients at greatest risk for pedal complications, and the majority of our patients are diabetic. I've been in the room discussing the concern for melanoma on more than a few occasions over my 21-year career. The ulcerated end of the toe that ends up being an advanced rare case of acral lentiginous melanoma, or a rapidly spreading black area on the skin of the bottom of the foot that goes unseen and then comes back as malignant melanoma. These are relatively easy to biopsy in the clinic, and once we get the results back, the biopsies confirming either a benign lesion or melanoma, then we can take that patient to the operating room and sometimes remove a toe, sometimes remove part of a foot. Sometimes we have the most difficult conversations of our career, and we're talking to patients about loss of limb in order to save their life. We work very closely with general surgery, vascular surgery, oncology for our best outcomes. People may or may not know the legendary reggae musician Bob Marley, who was diagnosed with acral lentiginous melanoma in 1977. He refused a toe amputation and elected for a less radical excision of the nail and the surrounding tissues. And he had no other treatment, and then unfortunately passed away at a very young age, 4 years later, when he was 36. So podiatry, we get to see a lot of dermatologic conditions and a lot of other kind of little areas of vascular rheumatology, a little bit of general surgery in the lower extremity, ortho with trauma. So it just, podiatry's just enabled me to kind of practice a little bit in all these different areas and kind of keep me interested and keep the day exciting.
Awesome. That's fantastic. Dr. Cleaver, what about you? So you told us a little bit already about the path that you took in order to receive your training, but why? Why was this the direction that you chose to head?
Well, real quick, I just want to say it's a great panel because these are a lot of the other kind of specialties within dermatology that I work with on a regular basis. And as Dr. Lowell just mentioned about Bob Marley, I mentioned that every time I look at someone's foot, I bring up that fact, and many people never look at their feet looking for those moles. And so, this is a great panel to be able to discuss these things. I think any of us that go into medicine are interested in primarily they have to have a reason why. And I think for most of us, it's to help other people, and that should be the reason for all of us going into it. And there's different reasons for that. I was just naturally drawn to it. Dermatology is a wonderful specialty to go into. It's very visual, so you have to be a visual person first of all. You have to appreciate what we see, and for the patients, that's what they see. If a patient has high blood pressure, they don't realize it most of the time. They don't see those differences, or you get diagnosed with diabetes, as a lot of the lower extremity complications can occur with that. It's not something that they see. It's something that they might get diagnosed when they go see a doctor with, but it's not something that they see. With dermatology, the patients know when they're improving, when they're not improving. And so number one, is very visual for us as practitioners to be able to look at them and say, hey, you're getting better. And they know they're getting better, or they know they're not getting better as well. So first of all, you have to have that visual aspect. The other thing that I love dermatology about it is it allows me to do lots of different things on any particular day. So I can see a patient that is 2 days old, 1 day old, and I can see a 101-year-old patient on that same day. And so I can see the whole gamut of patient populations. I get to see a variety of experiences of patient populations. I can go and see an acne patient, discuss their condition, a psoriasis patient where we can discuss the immunological consequences of their psoriasis and other comorbidities that might go along with it, such as hypertension and cardiovascular disease. But I can also see a skin cancer, a melanoma, a basal cell carcinoma, which are extremely common, and we can actually surgically excise those as well. So we get the procedural aspect of it too. So we get to see the things, we get to have those regular visits that you might in a family medicine office, but at the same time, we get to do lots of procedural things, and that's very exciting. We also have the cosmetic side of things as well. So we can do Botox, fillers, lasers. We get the technology part of things. So we really kind of get all aspects of medicine and science in general. And so that's why I love dermatology. It's something different every day. It keeps it exciting. It's also it's something that moves on a more rapid pace too. It's not something that, again, because it's visual, we can look at that person and give them that diagnosis. And it's not something we have to wait for imaging on. We have to send them for more tests. Everyone will, of course, do biopsies, but again, for the most part, again, we can see and be able to diagnose it. So you get that immediate satisfaction for the patients and hopefully for yourself as well as you're trying to diagnose these difficult conditions. So.
Outstanding. Dr. Sims, tell us about your why. You started talking a little bit about your training earlier, so let's dig into that. So you put your training all together and you did it all by yourself. So talk to us about that.
I did kind of piece something together for myself so I could do this. But what ended up happening was I was very much set on using many of my skill sets in acupuncture and using IV therapy. And I worked in an inpatient drug rehab. I was all about doing manipulation because, once again, I started out in osteopathic school because I wanted to learn how to do the osteopathic manipulation. And I still do that in my practice. Naturopaths are trained in naturopathic manipulation, but it's a little different. But I leaned into my previous training. So I was like, I want to do adjustments, I want to do IV therapy, I want to do acupuncture, and I want to help people who are in rehab and they're trying to get their life together. We have wonderful detox protocols for that to help naturally. But what ended up happening was I was teaching at a medical school because at Sonoran University, I was an adjunct professor there. I was teaching the medicine class where we talk about addiction medicine. And I ended up having a case in clinic of someone with severe cystic acne. And I had never seen a case like this before. And this was many years ago, like about 14 years ago. And it was like little like ping pong balls on her face. She had been to a dermatologist. She had been injected with steroids. Nothing was working. So she had this impossible case. And I was like, well, all I know is I know these principles of naturopathic medicine. I'm in practice now. I'm teaching. I'm going to use this to heal you from the inside out. And what we've learned in naturopathic medicine is that when the body is healthy, the skin can heal because it's just a reflection of what's going on the inside. And so nothing had worked, and we were her only choice. And I said, you know what, you're going to be my miracle patient. We're just going to work, just be patient with me, and we're going to do these things for you. So I took a lot of the practices that I learned in the rehab, from detoxification and being on a healthy diet and all of those principles of supporting the liver health. And I took them and I used them on this patient. And within 4 months, she had completely clear acne. I have it all on my website. She's done, she came to my book launch when I released my book in 2015. She has been like my biggest cheerleader because she was my very first patient. And then I took all of those skills that I learned in the rehab, and then I deep dived into that. And I started going to conferences and learning in integrative dermatology conferences and just kind of understanding what's going on the inside of the body when the body expresses the cystic acne. And so that's where mine came in. It really was a labor of love for a patient, trying to get her better. And then I became the go-to person in the clinic because they were like, well, did you see Dr. Sims is right up in the paper? She has these before and after pictures. She's the acne doctor. And I was like, wait a minute, I do rehab and I'm doing alcohol withdrawal. That's not my thing, but it became my thing. And so then I started seeing more and more. So tough cases would always come to me because the assumption was that I was the go-to girl for acne. And I became that person over the years of seeing more and more patients with different variations of acne. And then it became eczema, then it was psoriasis. And then I added hair loss because that's something that women of color deal with. And so that is how it started. And for me, a big part of that, being a Black woman and a Black doctor, I had patients who came to me who had seen dermatologists who had turned them away because they were like, I'm sorry, I can't help you. I'm not good at treating skin of color. I don't know what that disease is. Very fortunately, we are in an age now where people are learning more, and there is a big push to have doctors be more diverse and have an understanding of all skin types and understanding all colors and all hair types. But back in the day, it wasn't that. And we still have a long way to go. So people would come to me also because their dermatologist wasn't aware of how to treat a person with skin of color. And there was no Black dermatologist for hundreds of miles around because it's a very, I think it's a difficult specialty to get into. And I think that I take my hat off to all dermatologists because I just remember being like, oh, those are the geniuses in medical school, everybody that wanted to go in dermatology, but it was very hard to find Black dermatologists. So people would come to me out of not being able to find someone that could see skin of color. And then people came to me with very tough cases that were not responding to medications. And so I ended up carving myself this focus. And so as a naturopathic doctor, just so that people understand, we don't have specialties because that's a guarded term legally. So I am not a dermatologist. I am a naturopathic doctor who has a focus in skin. And it's because of my years of treating skin that I've developed protocols that work in people. But we also specialize in being like an individual doctor. I sit with each patient and I spend 90 minutes in our first visit and I tear apart, I'm looking at their diet, their lifestyle. We ask way too many questions about poop. I have to know everything. I know about my patients, everything from the rooter to the tutor, because I am from Texas. So we say that from the rooter to the tutor, I ask all the questions and I have an intimate understanding of what they're putting in their mouth how they're reacting to it. And then I do the specialty testing. And so I can get a little bit more in depth with what they're doing on a day-to-day basis and give them a protocol that's going to help them take control of their health. Because a lot of times people don't realize it's things they're doing every day that's causing their shift in hormones, that's causing their diet is awful. And these little things make a really big difference, not only in just clearing their skin, but also making medication work like it's supposed to work, because people don't take medication right and they don't know. And they ask me, they're like, well, my doctor told me to do this, but I didn't want to do it. And I'm like, wait a minute, like, let's talk to the doctor and see why he wants you to do this or why she wants you to do that. So I enjoy having that relationship with my patients where I can get intimate with them and be their cheerleader and their support and kind of a translator for them about why they're doing certain things and what's not working for them, and catering the treatment protocol to their lifestyle.
Excellent. Dr. Sims, we've got two questions in the chat, and maybe you can drop the answers into the chat. One is, can you share the website that you referenced, your website? And then somebody has asked for the book title as well. So if you can drop that into the chat, that would be awesome.
I'll drop it in.
Dr. Cleaver, so Dr. Sims just said you had to be a genius in order to be a dermatologist. So tell us.
I think he's a genius. That's subjective. I think he had to be a genius.
So the question is, tell us a little bit about your training. Do only the top 5% of your graduating medical class get into dermatology? What does it take to become the dermatologist in the room?
Well, that's a great question, but I do want to go back to Dr. Sims mentioned something earlier about the rotator cuff basketball tournament, which is between the Kansas City school and the Kirksville school. And I used to play in it as well. So a few years ago. So I have trouble remembering who won. I think it was us, but I'll hold on to that. So
I would also like to say you guys threw really great parties there. So we can talk about it after the. I remember there was a really awesome party that you guys threw, and I was like, these AT Still students are amazing.
Well, you have to be able to get along with others that way. You know, so. But no, there's a great question back to the dermatology. And dermatology within the medical field is a competitive specialty. I'm the program director of the residency program here in Kirksville with the medical school, and it is competitive. However, it is if it is something that you want to do, it is available to any medical student that goes into it. You just have to work at it. And I know as a program director, we're not just looking necessarily at board scores or what percentage you were in that class. We want someone that's committed to the field, committed to their patients, more importantly. And we're in a rural, underserved area of the United States, and there's a lot of rural, underserved, and urban underserved areas in the United States that are without dermatology care. And that is our mission of our program, at least, is to train folks that want to go out to those areas and provide care to those people. And so I would take someone that wants to go to an underserved area over someone that's in the top 5% of their class every day. What your board scores are and what your percentage in class doesn't necessarily dictate what kind of physician or practitioner you are. It's about the care that you give to your patients, and that can come all across the range of statistics that you want to throw out there to try to measure somebody.
Okay, fantastic. Dr. Lowell, how about you? What was your training like going into podiatric medicine?
My training, the residency that I started at the time was a 1-year residency. And during that year, it developed into a 2nd year. And then after that, I did a combined geriatric and surgical fellowship. So I had a young son at home and thankfully a very supportive spouse. Otherwise, it might have been a little bit difficult. The hours were intense. The workload was immense. Was very demanding, getting up early, rounding on patients, going to the OR, spending time in the clinics. A lot of inpatient management, lots of consults. So that 3 years of training at the VA really set me up for a career at the VA, because when I walked in the door as a 4th year student, I think it was, doing an externship, I knew that the VA was for me. I just felt like it was my home. And you know, we look for residents like that when we're doing our interview process. We don't just go for the top 5% who may look really great on paper. We want those that are like really devoted to our veterans, and devoted to working really hard for a short few years to get everything that they need to succeed in their career afterwards. So my training was intense, and it just covered all aspects of many different professions, even a little bit of work in the prosthetist office at one point. And that enabled me to get where I am today.
Outstanding. So Sydney, great segue into telling us a little bit about what your training looks like, and kind of where you are right now in the process, right?
All right, so for me, I had to do a 2-year residency. We do a year in orthotics and a year in prosthetics, or now you can do an 18-month combined. So I did my year, I did both of them at the same place at the University of Wisconsin Hospital and Clinics, which was unique. And I think that's helped me, because that's where I learned to work with other team members within the medical care of my patients. And I really am appreciative of that, because I think we need a lot more interdisciplinary care, which we learned that at my school, because we did a little segment with the PA students and physical therapy students, so that we could learn about what each of our part within the care for a patient, which has been, I love it, because now I know how to communicate with doctors professionally and know what to ask for, know how to help my patients advocate for what they need. And I can advocate for my patients. And now I'm in my 3rd year post residency, and I work with, like Dr. Cleaver said, anybody from a couple of weeks old all the way until 100 years old. And it's just nice to have a variety, because I have a different hat. Kids are fun. Like, kids are resilient. They're fun. They challenge you. They make you work for sure. And I love working with them. And then adults, I mean, they're the same. They're just a little bit older depending on them. And it's just nice to be able to connect and have a variety of different patients and meet them at their level and just help them get to where they need to be.
Outstanding. I love it. Okay. I'm going to do one more prompt for if you're sitting in our audience tonight and you want to ask a specific question, drop it in the chat. We'll make sure it gets asked. Or like I said, if you feel like you are brave and want to come off of mute and ask it, you're welcome to do that as well. Just put your hand up and we'll call on you. This goes out to the entire panel. Tell us a little bit about a day in the life, or an exciting case, or what gets you out of bed every day to do the work that you do. And anybody can answer.
I'll start.
Absolutely.
The field of podiatry is both medicine and surgery based. And the most frequent characteristic of the podiatry field that I hear is the overall kind of positive work-life balance and career flexibility that it provides. Once you're out of residency, the work schedule is conducive to that kind of lifestyle, not so much while you're a resident. The daily work environment is highly dependent upon the location and type of practice that you are in. For instance, I work at a very busy VA hospital with a large affiliated residency program, and myself and the other attendings, we share call. We have a high census of traumas and wounds and infections during the day, evenings, weekends. It doesn't matter what time it is, 24/7 the ER is open, and 24/7, 365 we respond. If you're in a busy group practice associated with the hospital, you might share call and get some of these patients when you're on call, or you may want to end up in a smaller group and not take any call at all. That type of practice would have less acute patients and more office and outpatient surgery procedures. Our population is highly comorbid and complex, and has multifaceted aspects to their care that kind of challenges us a great deal. I'm very grateful how my profession has enabled me to form my career throughout the years. And by focusing on the lower extremity, it allows me, like I said before, to be involved in all aspects of derm, rheumatology, diabetes, neurology, vascular, sports medicine, a little bit of pediatrics. I am at a VA, biomechanics and surgery, and it keeps me busy. Later on in my career, I've gone into academics more and working with our national organizations and doing some committee work and being on some boards. And that has really kind of had me go full circle with my interest in being a residency director and residency training, and now being part of the policymakers and sitting at the table discussing the future of our profession.
Outstanding. Thank you. Anybody else have a day in the life or maybe an exciting case that they want to talk about a little bit?
I'll
just-
go.
Go ahead.
Okay, doctor.
No, go ahead, Dr. Sims, please.
Okay. So as far as like a day in the life, I wouldn't say it's as exciting because I like to talk though. So I get to talk to my patients for about 45 minutes each. So I start my day and then I am transitioning. So I'm going to talk about what it was like in the clinic and now my transition into online care. So in the clinic, I would start my day, my first patient, because I was in my own private practice. And before I've had a solo practice and I've been in a practice with other practitioners, I start my day when I want. It's a cash pay practice. It's not insurance based. So and that is that you won't really have to know more about that until you actually get out of medical school, but just letting you know there are practices that take insurance and those that take cash. So I was a cash-based practice and patients would come in, they would book their appointment at 9, and then I would basically see patients from 9 to 5. And so I would see my first patient 9 to 9:45, then 15 minutes wrapping up my charts and go to the next patient. And each of the cases, because I saw acne and psoriasis and eczema, it's just what I see. So my patients would usually do a 15-minute free consultation with me to see if it was a case that I could help them with. I'm very upfront about what I can do, how long it's going to take. Mm-hmm. I generally would tell them that this process can be anywhere from 2 weeks to 4 months, with the average person taking 4 months to a year to have complete clear skin without the use of any medications. And so I'm very honest with them about my process because it is a lot of work for the patients. It's not easy. And we laugh and we cry. Most of the time we cry, then we laugh, because when patients come to see me, I'm usually the last resort. So I have a very interesting practice because it's not like people just come out the box. When people have acne, they go see a dermatologist, they go see their family medicine doctor. If they find me on the internet, it's because no one has been able to help them. So the cases are very interesting in that respect, because I have to figure out, why is this person not responding to steroids, antibiotics, antifungals, and every kitchen sink thing that the doctors have thrown at them? And so it's more of an investigation. So I feel like a detective, like a health detective, who's trying to figure out, why is this person not reacting? What have all the other doctors done? I'm looking at, years of medical work a lot of times in that first case, even before they come in, reviewing their charts, trying to see, well, what was missing? missing? Did they miss something? Did they forget to test something? And that's what naturopathic medicine is in general. So I think the reason I specifically love naturopathic medicine is for that, because I like that thought process. I like trying to figure out what's missing, what's that missing puzzle piece, and then saying, this is what it is. Here's the thing, I need you to do this. And then having them have this aha moment, and then more tears come. And it's just like, this is so wonderful, because I was able to help this person who has been living and suffering with this for years. And when women come to see me, and even little kids, it's like, they're like, I feel ugly. No one likes me. I don't want to show myself I don't want to go to school. I'm crying in the shower every day. I don't want to live. Like, people are really sad because of how they look, because our skin is the first thing people see. So having that opportunity to help someone clear their skin and letting them know that it's not their fault, they didn't do anything wrong, but there's some things that they can do to change their diet or change their lifestyle that can help, it's just really rewarding for me. So that part is what I do it for. I do it for those cries. And I say laugh too, because I have trained in comedy with the Second City in Hollywood, and with Find a City Improv. I have to give my shout out to Find a City Improv in San Diego. And so I try to throw comedy in there. So I let them cry, but then I immediately get the laughs, because we have to get them in a positive state of mind and having hope that they can clear their skin, because without hope, we can't do anything. So that's what I do it for. And so that's my day. It's like, I talk to people from 8 to 5,
Nice.
45 minutes at a time. So if you want to do that, become a naturopathic doctor.
Dr. Cleaver, I think you were going to share something too.
Sure. So just to kind of go over a regular day for me, it's again, a variety of different patients from the young to the old, which is always fun. And it's a variety of different appointments too. I see it again a little bit more often than 45 minutes, so more shorter paced visits. But it is also kind of getting to what they need to have done. And so about half my patients are inflammatory skin conditions, where it's acne, it's psoriasis, it's lupus. It's a laundry list that's about 600 pages long of different conditions that are within that. But then the other half is all related to sun damage, and that sun damage is extended across the whole United States. But we're in a rural area that's mostly agriculture. So there's a lot of farmers that have spent a lot of days in the sun. And so there's a lot of skin cancer, which include the basal cells, the squamous cells, and as Dr. Lau mentioned, the melanomas, which are, of course, the most dangerous type of skin cancers that we're all trying to prevent and stop. So again, about half the day with the inflammatory type, half with sun-related stuff. And then I spend half my day doing surgeries as well. So again, we do wide excisions where we cut out anything from simple skin cancers that I just mentioned to cysts, the stuff you see in Dr. Pimple Popper, we do on a regular basis, and it's not nearly as exciting as what it's made out to be in the videos, but just as stinky as what you might imagine, and I'm sure everyone else here can agree with that. And then we do skin cancer surgeries, something called Mohs micrographic surgery, where we carefully cut out a skin tumor. We actually look at it underneath the microscope while the patient's in the office. We look at 100% of the margin, we clear it, and then we close that defect. And a lot of times it's on the face. So we do a lot of plastic surgery style rotation flaps and different types of things on the face to close these defects that we get from these skin cancers. So again, it allows us to do a lot of different things in an individual day, and it creates a lot of diversity within your day. You can also specialize as much as you want to with dermatology too. So you can go down one rabbit hole. You can just do dermatopathology if you just want to look underneath the microscope. If you just want to do skin cancer surgery, you can do that. Wow. So there's a lot of options for it. There's just pediatric dermatology if you only want to do that. So lots of great opportunities to pursue lots of different things in dermatology. So, but it's a fun and diverse day, and keeps me getting up every morning and looking forward to it.
I don't know if anybody was checking Dr. Cleaver's math, but he has like 150% of his day accounted for by the end of that. So
it's a busy day. I'll add one other thing just about dermatology in general, and I think everyone on the panel can probably see it, but most of us that are within dermatology, within skin-related stuff, we are happy people, and there's a reason for that. We can help our patients, it's a great environment to work in as a provider.
Sydney, how about you? What does a day in the life look like?
Very similar to Dr. Cleaver. I see a variety of different patients, different ages. I see upper extremity, not so much prosthetics, but orthotics, spinal, lower extremity, orthotics and prosthetics. A lot of pediatric right now at the clinic I'm in. But then also we recently got into scanning, so it's nice to be able to use the newer technology. So we're scanning and we're 3D printing devices. So that's the new exciting thing that I'm getting to do and learning to love. It's a journey. It's a learning experience. And in our field, what I love is you can do something, you can do something, break it, but you can always replace it. Like, it's a learning. You're supposed to break things. That's what I tell my patients, especially my pediatric ones. You're going to break it. I want you to break it. That means I have to do my job better. Like, please challenge me. All my pediatric patients, I will tell them, and it's always challenge accepted. So I really love being able to do that. And then on top of that, we do some volunteer work within the community for lower economical patients who can't afford devices. So we're helping them find, I'm really big about helping find other resources so that they can receive, especially limbs. Orthotics, there's not much, but definitely if they have a missing limb. So I get to volunteer, and then I just get to work. It's fun.
Yeah. That's awesome. That's awesome. Okay, does anybody in our audience want to come off of mute and ask a question? I didn't see any hands. I just wanted to ask, because if not, we've got about 10 or 15 minutes left. And if there aren't any questions from the audience, then I'm going to ask one more. So so somebody is sitting in the audience tonight and they are like, oh my gosh, I have found what I want to do. Like, this lit my fuse tonight. I am ready to learn more. How could somebody sitting in our audience or watching this learn more about your profession? Who hasn't had a chance to go first yet? Dr. Sims, why don't you take that one?
Yes. I was trying to make sure. I'm like, do I know the website? It's AANMC.org. It's the American, wait, let me not say it. AANMC. It's the naturopathic medical students, basically, for all the colleges.
I think I got that right.
AANMC.org. Yes.
Yeah.
I don't know why in my brain I'm thinking of the NMC, which is the Naturopathic Medical Student Association, NMSA, but that's not the right one. You can also go there and see the naturopathic medical students, but AANMC.org is where you can find out about all the medical colleges. I did want to say one thing, because naturopathic doctors are not licensed in every state, so that there is an understanding. Because naturopathic doctors are not licensed in every state has different licensure requirements and what you can do. So when I was living in Arizona, I was able to do more minor surgery, because we're trained in minor surgery. So I could remove like skin tags, and I could, do Botox and fillers and different things. And then when you move to California, I can't do any of the minor surgery, because you are not allowed to like puncture the skin. Like, you can't incise the skin. However, you can do facials. So like PRP facials and microneedling facials, what they call the vampire facials, we were able to do those. So that was a part of my practice as well. And then when you come to Texas, where I'm from, naturopathic doctors are not licensed. So I cannot touch a patient and be like and interpret labs, which is very different from being a doctor that prescribes in California and a doctor that does surgery in Arizona. So that is something that the AANMC, if you look on the website, you'll see what states are licensed. Check to see like, where do you want to practice? Because it is difficult. We're still working to get all the states licensed. That's something that I've been a part of in the past and going to do more. We are working to have a dermatology residency, a naturopathic dermatology residency, but we have to have enough interest in that and enough students, and doctors. So all of this is coming. And so you can be a pioneer in the profession because, like I said, there is no naturopathic residency for dermatology, but you can learn everything about naturopathic doctors at AANMC.org. You can also go to NMSA, the Naturopathic Medical Student Association, and link up with some naturopathic medical students and learn what it's like to go to naturopathic medical school from them.
Anybody else? How could somebody learn more about your profession?
I'll just add real quick. I think probably each of our fields has their own specialty site. However, what I will say that's very helpful, I think, whenever you're looking at any profession, is finding a mentor. And if you can find a mentor that's in your field that you want to go into, go talk with them, sit down with them, or just call them up and see if you can spend a day in their life. And many people, and especially providers, are all used to that. We've all been educated by others, and so it's our responsibility as providers to educate back. And so that's we're all here for that. And so if you can find a mentor in whichever area you're looking into, then you can get an idea of what you need to do and those goals that you need to pursue.
I love that. Every one of the students sitting in our audience tonight needs to find a mentor, somebody to shadow, somebody that you can get ideas from, that you can run your ideas through. So absolutely 100%.
And don't be afraid to do it either.
Correct. Absolutely. Absolutely. Yeah, Sydney, Dr. Lowell. Yep.
AACPM, we all have our little acronyms: American Association of College of Podiatric Medicine, Step Into Podiatry. Both those, if you Google, will lead you to a place where you can find more info on podiatry. My name, Danae.Lowell@va.gov. I'll speak to anybody who connects with me. We can do a virtual. I can try to hook you up with somebody in your area. I agree with Dr. Cleaver. You got to find a mentor. When I was in pre-med, I went and visited a number of different specialists, different folks, and I found the College of Podiatry, and everybody was happy. Everybody's was having a good day when I was around them. So it just really pulled me into the profession, and I can provide that to others. My whiteboard in my office says a list of all the people I've mentored and helped guide into podiatry and through podiatry college. So I am personally available and can answer any questions at any time.
Thank you. That's very generous of you. I appreciate that. Sydney, what about you? Anything that somebody can do to learn more?
Yes, I also agree. Shadowing is the best way to know if you're going to like a career. For my profession, we actually, before you can apply to school, we had to do, depending on the school you apply to, we had to do anywhere between 100 to 250 hours of shadowing. So yes, we're all welcome. You're welcome to talk to anybody, and we love to teach and love to show you what we do. For us, we have ncope.org. That's one of the sites you can go and look at it. It give you information about the schools. There's not very many schools for OMP, so it will give you schools breakdown and show you how to apply. Also, there's ABC, the American Board of Certification for Orthotics, Prosthetics, and Pet Orthotics. And that gives you a better overview about the training that you receive, the exams that you'll have to take, and how you can become certified.
Okay, excellent. We have a question from the audience, and I believe Brian wants to come off mute and ask. Brian, you have the floor.
Hello. Can you guys hear me?
Yep.
Okay, all right, just making sure. Yeah, so I subscribe to several people on YouTube, and they talk about dermatology. And I'm not sure if you guys, hinted on this or not, but how would you guys describe your work-life balance? Because they say that, like, one of the reasons why you guys are competitive is not necessarily the pay, which is, in line typically with specialists. It is actually the work-life balance, the clinical hours that you guys normally do. Like, usually, like, you guys get to treat like an 8 to 5 Monday through Friday, and a lot of people will kill for that, as opposed to, like, 90 hours a week, and your soul is the hospital's, basically. Like, if they beckon, you come. So how would you guys describe your work-life balance? Thank you.
Great question, Brian. Thank you.
So it is attractive for that reason as well. And I think a lot of people are interested in it. I don't think people go into it for it, but I think people become interested in it for that reason. And there are some dermatologic emergencies where we get called to the ER, where we're in the hospital, but there's not many of them. And so we do get a better work-life balance. I get to go home at the end of the day and see my two wonderful kids and hang out with them and help coach their basketball team. So the next time we're in the rotator, they're in the rotator cuff in the future, we can beat that Kansas City school. Again, it does enable that work-life balance. And I think that's, again, I mentioned a little bit earlier, but many of us that are in dermatology, we are happy people and we're satisfied with our life because we get, again, that satisfaction helping patients, but we also get that satisfaction our outside life as well with family or whatever that it draws your interest.
Thank you, Brian. That was an excellent question. We've got one more question from the audience, somebody who is at their library right now and wants to be respectful of the quiet zone. So I appreciate that. Specifically for Dr. Cleaver, I open it up to the panel as well, just in case there's other thoughts or suggestions. I'm a senior and I'm really interested in dermatology. How would you recommend I approach a dermatologist to perhaps shadow them and see what their day is like? I know they usually have residents, but do you think they would allow an undergraduate to shadow them?
Yes, so not actually, the majority of dermatologists would not have residents with them. We're an exception with it. If you're at a university center, yet there's a good chance there's residents at a metropolitan area. But if you're anywhere else, there's plenty of suburban dermatologists and other ones that are not necessarily affiliated with a residency program that can take undergraduate students and then later on medical students too. So we actually have undergraduate students that will rotate through our office. They'll spend a day, spend a couple of days, spend a week, depending on the situation, and to experience it and to see it. And then sometimes, we're able to write a letter of recommendation for that undergraduate for medical school. And then later on, when you're doing medical school, it's important to get that experience in dermatology and getting those letters of recommendation. So I would, look around the area that you're in, look for, and really just start calling people. If you have a connection with someone, that's great. If you have if you had a dermatologist growing up because you had acne, that's a great person to talk, if you liked them, I guess, and you respected what they did. But, call them up and say, hey, I'm one of your patients. I'd be interested in coming in and seeing what you do for a day to see if I like it or not. So, and if not that initial contact, just really start calling offices, and you'll get a lot of no's, but you have to be persistent. And that's with anything you do. If you want to do it, you have to be a little bit persistent and call around and find that right place, and you will find it, and you'll have that opportunity to do it. And then they can help guide you from there.
100% agree. Yeah, Dr. Sims, was that you? Yeah, go ahead.
I would like to A-band that, because even as a high school student, I shadowed doctors by calling and writing them. So the moment I decided I was like, I'm going to be a doctor, and I was like 17, I started calling every doctor. I shadowed nephrologists. Because we were in a town where they didn't have medical students, residents. A lot of them loved teaching, but they hadn't done it in years, and they like having the younger generation and mentoring. I got the best mentorship from those doctors. I got to rotate with different specialties because this was back in the day now. I will say I used the phone book. I went down the phone book and I called everybody. Now you would use the internet. We have computers now, but back then I was calling people and writing actual letters because no one had email, barely. So I wrote letters, and they were very impressed with me as a student, as a high schooler wanting to shadow, and the same thing in undergrad. There are also programs that you can do, especially if there's some for minority students, there's some for just people interested. There are summer programs, and a lot of the medical schools have them. So what you do is you go to a summer program, you sign up, they will give you a class so you kind of in 6 weeks, you'll do like assimilation of medical school. They'll give you training for the MCAT. They'll teach you what it's like. They'll give you interview training. So look up summer medical school programs. A lot of them are HCOP programs. I can't remember, Health Careers Opportunities Program, I think is HCOP is what they stand for. They might have changed it.
I think that's
There's
the
a lot of
SHPEP program now, and I just dropped that website into the chat.
Perfect. That I did one every year. They have research summer programs. I know Yale has one. A friend of mine did that one. I did one at University of Alabama School of Medicine, and they have them. And they also have post-bac programs. So after you've gotten your degree, you can go to a post-bac at some of the medical schools. Well, they will also do summer programs to help prepare you for medical school entry if you didn't have a really good stellar pre-med advisor. So there are programs out there that will help you get into medical school and become a better applicant, because it's very competitive. And I don't know, speaking for Texas, especially if you go to medical schools in Texas, they have their own separate system, and it's a very competitive system. So you want to make yourself a very good looking applicant. I was a very average student, to be honest. I got into medical school like a regular medical school before I went to naturopathic school. And it was because I did the shadowing and I had the mentorship and I had really good letters of recommendation, because I put myself out there and was like, I'm an AB student. There are people that are, 4.0s doing like perfect MCATs. Everything was average, but I was a leader and I got myself out there and I showed that I wanted to be in medical school and that I was really serious about my career. And that's really important. So do research, do HCOP or the new HSP. I can't remember in the chat.
Yes, SHPEP in the chat.
In the chat, and do a summer program and get mentorship.
Yeah. SHPEP is actually one of the HPW partners, which is why I am so familiar with them. And they will be at the career fair on Thursday nights. So if you want to come and learn about their program and the free services that they offer, Thursday nights career fair would be an excellent opportunity. I want to be respectful of our panelists' time, and I was gonna say, Sheree, thank you, Sheree. Sheree just dropped another resource into the chat. I appreciate that. She's with the NCOPE organization. So I do want to be respectful of everybody's time, and we are at the top of the hour. I really honestly think that we could continue this conversation for like another half an hour, but I want to start to wrap things up and say thank you to our panelists for participating with us tonight. Again, dermatology questions are like the #1 topic that we get questions about here at Health Professions Week. So if you still have questions, you can hit reply to any email that you have gotten from Health Professions Week. And if I can't answer it, I will get it to one of these excellent professionals who can answer it. And we can continue this conversation. We can continue this conversation on Thursday night at the career fair as well. So I just a quick shout out to, we have ACOM represented tonight. That's the osteopathic, apologies, medical colleges represented here. NCOPE, which is the orthotists and prosthetists. The naturopathic medical colleges are represented here tonight. Podiatric medical colleges are represented here tonight. Yes, exactly. I do also want to give a quick shout out to PAEA, because we had a physician assistant scheduled tonight, and unfortunately her power went out because of the storms where she's at.